Extract 1. Questions 1 to 12.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Okay, so when was the last time you saw an optometrist?
I would say about 6 months ago.
Okay, great. So did you get a new pair of glasses then?
No, I didn't.
Okay, and are you wearing anything at the moment?
Yes, I've got glasses which I got about a year ago.
Okay. And what do you normally wear those glasses for?
Reading.
Reading, okay.
I generally don't wear them, for distance.
Okay, great. So are you happy with how you see in a distance?
Yes, I don't have a problem there.
Mm-hmm.
I'm just thinking, that it's getting a bit more difficult for reading.
Okay.
Especially small print. The phone book, for example, is really difficult for me.
Yeah, well, the phone book is difficult anyway, I think. But yeah, that can certainly be quite frustrating.
Yes.
So do you think the difficulty was there when you got your most recent glasses a year ago, or do you think it's gone downhill since then?
I think that my vision in my good eye is not as good as it was 12 months ago.
Okay. All right. So tell me about your eye history then.
Yes, well, it goes back quite a bit. Around about 06, I started to notice a slight waviness in lines that I was reading.
Okay. And that was in your right eye?
In my right eye.
Okay.
And the ophthalmologist said, you've got a problem with your right eye. You should see a specialist, a retinal specialist. So that was organised by about, late 06, maybe into 07.
Okay.
The specialist did a scan and decided that, there was an accumulation of fluid in the front of the retina.
Okay.
And prescribed Lucentis injection. That was done monthly for, I think, about 2 years.
Okay.
Until I eventually changed over to the eye and ear, mainly because it was costing quite a bit.
So how often are you seeing the specialist at the eye and ear now?
Well, I used to see them initially about 3 monthly,
yes.
But now it's about 6 monthly.
Great, okay. So is there someone that you see there specifically, or are you just sort of going through the public clinic?
The public clinic, but in the retinal clinic that I attend, there are about 3 doctors, and I see one or other of those 3.
Okay, so you are getting that continuum of care.
Oh, yes.
Great.
Yes.
And are they fairly happy with how stable that right eye is at the moment?
Well, I think they are disappointed that it was not successful. I mean, it's... I think I've had something like 25 injections of Lucentis.
Yeah.
And to think that, I've lost central vision in the right eye. They're not too happy about that. But the last scan they did, there was no fluid there.
Great.
So I presume it's just a wait and watch now and see what.
Right. Yeah.
See what eventuates.
So are you aware of what the Amsler chart does?
Yes. I've been using it for some years now.
Okay, so I'll just run through it just to make sure that you're doing it properly, because a lot of people do it every day and they don't realise they're not doing it properly, and as a result, there's no point. So it basically checks the very, very central visual field of both eyes. So it's really important that you cover one eye when you're doing it. The main thing when you're doing that Amsler chart is not to really look for those little nitty-gritty things, but to gauge any significant change.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Hansen. I'm Dr. Hodson.
Hello.
I understand you're having some pain.
Oh, yes, I have stomach pain.
Yes. When did it start?
Last night.
Last night.
Yeah.
About what time?
9.
9.
Yeah.
Where was it when it first started?
It was kind of generalized.
All around?
Yeah.
Okay. Did it change at all?
Yeah.
How did it change?
Now, this morning when I woke up, it was more central,
Okay.
and now it's more over here.
On the right side. What kind of pain is it?
It's really, it's right there.
Okay.
And it's constant.
It's constant. Is it like a grabbing pain, a stabbing pain, a dull ache?
Dull ache.
A dull ache. Is it going around the back at
No.
all? Down in the groin area?
No.
It's just right there now. Okay,
Yeah.
but it started more generalized.
Yeah.
Okay. On a scale of 1 to 10, last night, how bad was the pain?
I would say 2.
A 2. And now, what would you say?
7.
A 7. Okay. When it first started, were you doing anything in particular? Did you lift something
No, I
heavy?
was
Did you
just-
twist? Was there any trauma?
I was just looking at the TV.
Okay. All right. Through the night, did it wake you up?
No, I slept
You were able to
Okay,
sleep?
yeah.
Okay. Do you feel nauseated?
this morning.
This morning. Did you throw up?
Yeah, an hour ago.
An hour ago. How's your appetite? Do you feel hungry? Do you want to eat?
Oh, no.
You don't, eh? Okay. Did you have any fever?
I did not take it, but now I feel kind of feverish.
You feel a bit feverish. Did you have any night sweats last night?
No,
No, or chills where you were shaking?
no, but this morning,
This morning you had.
started, yeah.
Okay. Tell me about your bowel movements. When was the last one?
Yesterday morning,
Okay. Was it normal?
Yeah.
Yeah. Did you have a period of time in the last week or so where you were either constipated or had diarrhea?
no,
Have you recently noticed any blood in your stools?
no,
Or any black diarrhea stool?
no,
No. Are you having problems with bladder in terms of burning to urinate, having to get up at night to urinate?
No.
No. Have you seen any blood in your urine?
no,
No. Okay. Tell me about your periods. Do you still menstruate?
no, don't know. It stopped 5 years ago.
5 years ago. Okay. All right. And you haven't had any spotting, bleeding at all?
No.
And are you sexually active?
not for the last 6 months.
No new partners then for the 6 months. Okay, all right. Have you ever had any problems with this kind of pain before?
No.
Similar pain?
No.
No, this is the first time. Tell me about your health. Do you have any other medical problems?
No.
High blood pressure, cholesterol problems, heart problems?
No.
Do you take medications?
Just homeopathic one. Yeah.
Okay, which ones are those?
Primrose. I'm sorry. I take selenium and I take vitamin C and A and primrose tablets.
Primrose tablets,
Yeah.
okay. Do you take any aspirin at all?
No.
No? Okay. Any Advil, ibuprofen? No. Okay. Do you have allergies to medications?
No.
No. Have you ever had surgery before?
No.
No. So you don't know if you have any issues regarding general anesthetic,
No.
problems like that. Family history in particular of bleeding tendencies or blood clot problems?
No.
No. Okay. Have you ever had kidney infections or bladder infections?
Never.
No. All right. Okay. So I'm going to examine you. Okay. So if you want to bring your legs down here, just bring them down gently. I know it's going to hurt a little bit. Yeah. Okay. And now I'm going to just have a look at your abdomen. Okay. So we're going to just expose here. And I'm going to look to see if your abdomen is distended. Do you feel bloated at all with your belly all swollen up? No. Okay. So it looks good. I don't see any swelling of your abdomen or any bulging anywhere. So now I'm going to give little taps, okay? So show me the area where you're sore. Here. Okay, so we're going to save that spot for last. So I'm just going to give little punches here. That hurts you a bit, eh? Okay. Now I'm just going to lightly palpate just on the top like that. That's all okay? How about down here? That hurts a bit, eh? Okay. Now I'm going to go deeper down, okay? That's okay there. And if I press here, do you feel it a bit? Where do you feel that when I'm pressing here? So you feel it on that side, okay. Now I'm going to go deeper here, okay. So I do see that your muscles are tensing up when I'm doing that, okay. I'm going to do another test where I'm going to press down and I'm going to let go, okay. So you tell me if it hurts. So I'm going to press down. I know it hurts here. I'm going to let go. Okay, that does hurt, eh? Now I'm going to do it on this side too. I'm going to press down. Okay, I'm going to let go. Oh, that really hurts. Okay, sorry about that. Now I'm going to listen for your bowel sounds. Okay. Now I should have done this before palpating you, but let me have a listen here. Okay, so I'm just going to listen in all 4 quadrants, in all area of the abdomen.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a nurse talking to a patient who's about to have a mammogram. Now read the question.
So, have you had a mammogram before?
No, I haven't, and I do have a few questions actually. Like, what about the radiation? Do I need to worry about the dose? Is it likely to be harmful in any way?
No, it's very low. In fact, it's similar to the amount you'd receive if you took a long-haul flight.
Oh, yes, that reminds me. When will I hear? 'Cause I'm away in New Zealand for a month from next Wednesday, and I'd like to know as soon as possible.
It'll take about 2 weeks, but if you're concerned, we can give you a number to call.
Oh, thanks. That'll be a real help, actually. Then, for me, the big question is it going to hurt? I've been hearing gruesome stories from friends, and my anxiety levels are going through the roof.
Okay, I understand. Perhaps you could tell me exactly what you've heard.
Question 26. You hear a doctor talking to a patient about a blood pressure monitor. Now read the question.
It's like a normal blood pressure monitor, but it's mobile. You wear it on a belt around your waist and it's attached to a cuff on your arm. Then you just go about your usual day-to-day activities and it takes your blood pressure at regular intervals. It's more accurate because we can avoid what's called a white coat syndrome. It beeps first, usually every 30 minutes or so. When that happens, you should sit down if you can, hold your arms still and keep the cuff level with your heart.
Do I have to wear it at night?
Yes, you do. You could put it under your pillow. It needs to stay on for 24 hours, though you don't have to wear the belt.
What about showering and stuff?
Well, I was about to say, you should avoid that, I'm afraid.
I see.
Question 27. You hear a dentist and her assistant talking about a problem with some sterilizing equipment. Now read the question.
Oh, no. It looks like the autoclave is playing up again. The temperature's only 117. That's 4 degrees lower than I set it for.
Yeah, I noticed that. Yesterday it was at 119 and I just couldn't get it to go any higher. Shall I have a look in the instruction manual and see if I can sort it out?
Well, that might invalidate the warranty. Could you find out whether the one next door's working properly? I expect it's because the hard water around here has caused a build-up of scale and that's affected its efficiency. Perhaps you could ask reception to get the company to come out as soon as possible. If they can't come tomorrow, we'll have to wait until Wednesday and make sure everyone knows it's out of order. If you could send a quick group email, that'd be great. That's the second time this has happened and it's still under guarantee.
Question 28. You hear a GP talking to a patient with hay fever. Now read the question.
How can I help you today?
I need something to help me manage my hay fever this summer. It's already become unbearable. I don't want to have to stay indoors when all my mates are out enjoying the good weather. We're all off camping next weekend, and I'd hate to miss out on that.
What's bothering you in particular? Perhaps I can give you something to make you more comfortable.
Well, I keep getting this horrible headache thing. It's like at the top of my nose, and it's really getting me down, to be honest. Then there are the watery eyes. I mean, I can feel them puffing up as soon as I leave the house. They're so itchy, red and painful and look awful. I've got a summer job working at music festivals, so there's no escaping. I'm literally in fields all day, every day. Is there something you can give me?
Question 29. You hear two nurses doing a patient handover at the change of shift. Now read the question.
So, in bed 6 we have 83-year-old Mr. Beard.
OK?
He was admitted this morning and he's been diagnosed with bacterial pneumonia of the right lung. He's quite poorly at the moment, but stable. He's lactose intolerant, so can you talk to the kitchen and organise something suitable for him?
OK.
Otherwise, he has no known allergies. He's been for a chest x-ray, but we're still waiting for the results to come through. We may need to do a CT scan too, but we'll have to wait to see what the x-ray results reveal before we can arrange that.
Right.
His SATs were at 57, so he's on 2 litres via a nasal cannula, and that's to be reviewed after 2 days, so not until tomorrow morning.
Mm-hmm.
Oh, and I forgot to mention, he had a fever of 39.4, so he's also on antibiotics via IV, which he's not very happy about.
Question 30. You hear a hospital manager briefing newly recruited staff about patient safety. Now read the question.
Within the information team, we provide a set of standard and custom-made reports to suit the needs of staff and patients. Our aim is to provide information into the patient's journey, from their arrival in the emergency department to their discharge from outpatients. One of my responsibilities is to ensure that the information we provide is clear, easy to understand and straightforward to use, so that we can look at areas of concern, things that are common across departments, and reassure ourselves that we are delivering quality care. When things go wrong, we're able to provide information from the system to enable the staff responsible to review the situation, understand, and learn what needs to be changed to avoid future events.
That is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1. Questions 31 to 36. You hear the lecture given by a physician on migraines and headaches. You have 90 seconds to read questions 31 to 36.
Hello everyone. I am going to explain to you migraines and headaches. If you've given much consideration to the factors that might encompass the different types of migraine and headaches, you probably imagine that they range from a dull throb that doesn't require any treatment to excruciating pain that would require a trip to the emergency room. But do you know that there are about 16 different classifications involving migraine and headaches? Interestingly, some of them don't even involve head pain at all. Here's a rundown of various types of migraine and headaches. An abdominal migraine is mainly in children of 5 to 9 years old. However, it can occur in adults as well. This type of migraine usually doesn't involve a headache, although children with abdominal migraines often have head pain when they grow older. Acephalgic or silent migraine has many migraine symptoms but without headache. Alice in Wonderland syndrome is a rare form of migraine aura that causes distortions in perception. Patients with Alice in Wonderland syndrome might feel as if they are growing smaller, then larger, or might find time seeming to speed up or slow down. Usually, children experience this condition more than adults. However, it can occur in people of any age. Symptoms of a basilar-type migraine can be confused with those of a stroke at times. This condition can cause speech slurring, unsteadiness, vertigo, and numbness. This type of a migraine isn't common, but one study showed it may occur in up to 10% of those who have a migraine with aura. If the headache occurs for more than 15 times a month, means it's a chronic daily headache. About 4% to 5% of people have chronic daily headache, which falls into numerous subcategories based on the characteristics of the headache. A chronic daily headache will have symptoms like snore and sleep problems. Cluster headaches are the most painful headache type that involve attacks of severe pain lasting between 15 and 180 minutes. This can occur once every other day or even up to 8 times in a day. Cluster headaches are diagnosed more often in men than in women. Hemicrania continua is a headache that doesn't stop that occurs on one side of the head. Pain is moderate but can spike into excruciating at times. Hemicrania continua is not considered a migraine but can share some symptoms with a migraine, including light sensitivity and nausea. However, the condition can be easily treated with a particular form of non-steroidal anti-inflammatory drug. A hemiplegic migraine is a rare form of a migraine where the patient experiences weakness on one side of the body, possibly accompanied by confusion or speech slurring. Ice pick headaches are stabbing, extremely intense headaches that can be absolutely terrifying. The condition generally lasts from 5 to 30 seconds. However, they can strike anywhere on the head, sensing as if an ice pick is being stuck in the head. New daily persistent headache is diagnosed with daily head pain that persists for 3 months or more. To diagnose this type of headache, the doctor must first rule out several other conditions that can cause similar symptoms. Pseudotumor cerebri, or idiopathic intracranial hypertension, is a condition in which the body either produces too much of the fluid found in the brain and spine or doesn't absorb the fluid properly. Pseudotumor cerebri means false brain tumor because the symptoms of this condition mimic a brain tumor. A retinal migraine causes flashes or sparkles of light, possibly combined with partial or complete temporary blindness, but only in one eye. This occurs before the headache phase of a migraine starts. The head pain generally commences within an hour of such visual symptoms and lasts up to 3 days. A transformed migraine starts as chronic migraine attacks, however, gradually or quickly transforms into almost daily and less severe head pain. Transformed migraine attacks can be accompanied by nausea, along with sensitivity to sound and light. Status migrainosus is a painful, debilitating migraine attack that lasts for more than 72 hours. However, in case moderate to severe migraine pain lasts for more than 72 hours with less than a solid 4-hour pain-free period while awake, it should be treated as an emergency. Attention-type headache is the most common form of headache, affecting about 80% of people, which is often called a band around the head. In this condition, one will have mild to moderate pain that can be alleviated with over-the-counter pain relievers.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Phantom odour perception is where you perceive an odour which, when you search for it in your immediate environment, you can't find where it's coming from, and in fact turns out not to be real. Here's Serge Negus, who's a producer at Triple J, telling James Bullen of the Health Report about his experience.
How did you come to have these phantom smells?
I had a traumatic brain injury from a skateboarding accident where I fractured my skull and had part of it removed and this titanium alloy plastic mold put in there. And one of the things that my mum did when she came in was put some lavender oil on my sheets at the hospital bed, and then she presented the lavender oil to my nose and I literally couldn't smell it. And so that was when I discovered that I couldn't smell anymore. And the doctors said that it's one of the most common things that you can have happen after having a head injury is you lose basically your olfactory nerve and a lot of taste too.
How did you feel when you realised that was happening?
You can get really bad smells with these phantom smells, things like burning flesh and these sorts of things, or really unnatural smells. I didn't get that. My smells were battered fish and chips and stuff like that, and passion fruit and mango and different things like that were really nice, and they came with a sense of euphoria. So for me, I didn't mind because I'd totally lost my sense of smell. So having these kind of phantom smells for me actually worked out. But I know that for some people it can be the opposite, and they can have smells that really are quite intense and very dark. And so people actually try and figure out ways of getting rid of their phantosmia, which I don't even know if it's possible. Apparently some people have tried to have their olfactories removed completely to try and stop it, but I don't know if it even works. The science around it, it's not that strong, I believe. But my experience with phantosmia has been quite positive.
And do you ever get the bad smells, or has it pretty much been good for you?
The only time I've ever had slightly bad smells have been smells that I literally couldn't describe to you. They're so unnatural. They come from such a weird place that because my brain's creating them, basically, that I'm confused by them. I'm like, what even is that? That's a smell that I've never even smelled before, obviously, because if my brain's creating this fake smell. But no, I've never had any of the bad ones. The worst thing I've had, which I actually kind of liked, was the smell of fresh cow manure. Do you ever play the game Which Would You Rather? And I'd always say to somebody, if you said to me, which would you rather, never be able to smell again or only be able to smell fresh cow manure for the rest of your life? I was like, well, you know what? Having experienced that, I would go with fresh cow manure for the rest of my life.
And how long do they last, and how powerful are they while they're going on?
They can last for a couple of days, once every 2 to 3 weeks, but sometimes they can be a couple of months without experiencing it. But because, like I said, I've had this positive experience with phantom smells, I look forward to them when they do happen, and so I'd actually like them to happen more.
Serge Negus throwing cowpats at James Bullen. Well, head injury is only one cause of phantom odour perception. To find out how common it is and what factors might be linked to it, Kathy Bainbridge and her colleagues at the US National Institute on Deafness and Other Communications Disorders studied a large population in the United States.
For some people, they pick up an odor. It's often unpleasant, or it's often described as a burning odor. And you might ask your friend or your partner, your spouse, hey, what's that smell of something burning? And they don't smell it at all. So it's an odor perception for which there's really no source, no identifiable source in the environment.
And how bothered are people by it?
I think it varies. Some people just describe it as kind of pesky, but for sure there's a subset of people who are really debilitated by this condition and who scour their house looking for the odor. My co-author, Dr. Don Leopold, he's described people who ripped up carpeting in order to try to find the source of the odor, and there really is nothing to be found.
It's under the radar, really, this issue.
It's never been studied in such a large population as the study that I participated in.
Tell us what you did.
In the United States, there's an ongoing national health survey, and it's been going on in its current form since 1999. And beginning in 2011, we had the opportunity to add a battery of smell and also taste questions and a couple of different physical exams. So we took the opportunity to add a question about phantom odors. So we collected, over the course of 4 years, data on over 7,000 people. And it turns out that 6.5% of adults over the age of 40 in the United States are willing to report that they smell phantom odors.
That sounds like an extraordinary percentage.
Yeah, it's surprisingly big. Our question was broad. It was, do you sometimes smell odors that are bad or foul or unpleasant? So we don't have the data to ask of the 6.5%, what proportion are really, really troubled by it. We don't have that data. We don't have data.
But some phantom odours are quite pleasant, aren't they?
The way we captured it in the survey, we phrased it as bad or burning, but I've heard from some people smell like cinnamon. A gentleman told me he smelled cinnamon and he associated that with his father. And they tend to be warm smells or hot smells. I've heard burnt milk, stale or hot bleach.
So you're always
diesel.
running into the kitchen to find out what's spilt over. So what factors, because this was the other thing that you looked at, is what predicted whether somebody had a phantom odour? Because it sounds from this that you've probably underestimated, if you haven't looked for the good odours, you've probably underestimated the phantom odour prevalence. But let's put that to one side. What were the factors predicting whether or not somebody was more likely than not to experience phantom odours?
Women were much more likely